Can we go without insurance? What if we got rid of all insurance altogether? That's something that I've been just thinking about, just kind of exploring from a thought process. Would that even be viable? Could we really go without insurance? No Medicaid, no Medicare, no private insurance. What would happen? Would that completely just crash the market? A lot of people would skin their knee, if you will. And I don't want to say skin their knee in the sense of literally, there would a lot of people would lose. Many people would go without insurance. Many people would die, probably very rapidly if they didn't have life extending treatment care, whatever. And I'm not advocating for this approach. I'm saying if we go without insurance, what would happen? On one side, in the short term, a lot of people would not have access to care, and that would be very detrimental to them. On the other side, it would put a lot of businesses underwater, including the massive insurance companies that seemingly everybody's complaining about. Patients complain about it, politicians complain about it, executives, except for those that work for the company, complain about it. And I would imagine even some of the folks within those companies have some complaints because they see what happens, and managing cash and investors and patients and doctors can be a challenge. So they might go under. All of the employees that work for them would also go under. But then I wonder if the cost would normalize. If insurance didn't exist and we had to pay directly for the care that we receive, number one, there'd be some more personal accountability. 4 out of the $5 trillion that we spend in our healthcare system can be allocated towards chronic disease. Most of that preventable. The CDC says that the United States, I want to say 73% of folks in the United States, per the CDC, has at least one chronic condition. Most of those chronic conditions are lifestyle related and can be prevented. You're talking about obesity, diabetes, heart disease, etc. The list goes on. So if insurance falls and some of the economy crumbles and many people lose their lives, which is very unfortunate, I don't want to minimize that downpact. I'm saying it's an aspect. We don't have to unpack that here. But would cost normalize? Would all of a sudden, if you go to get an oil change and it's $100 at one place, oh, I'm not going to do it. You go to another and it's 40 and you take it. Would that happen? Would price transparency have to come forward? Because now we, as the consumer, are directly driving the ship. Would hospital costs come down? Would the radiology and the ancillary services and the lab and procedures and drug costs, would they all come down because now the market has to compete? That's the benefit of a free market, is to let the economy decide. And with insurance products, whether it's government subsidized or private, the patient, the consumer, doesn't have the buying power. And then if they do get to purchase a good or service, it has to go through a review process, and then it comes back to them on the back end, and they're letting them know it was approved or denied. And so the person, the physician, the practitioner, the facility that's providing the care doesn't get paid, and the patient gets stuck in the middle, maybe having to pick up the tab or going towards a max out of pocket. So I don't know if it's worth exploring. Does it make sense to continually throw a lot of dollars either via subsidy to private or increasing the current government funded programs, expanding those programs to just keep giving people access when the chronic disease is, I mean, the chronic disease, if you look at the path over the last 70 years, is exponentially going up. We can't seem to stop it or get in front of it. So what are the solutions? That currently comes from the chronic disease, and once again, of the 73% of the Americans that have at least a chronic disease, most of these are lifestyle diseases that start outside of the healthcare system. How do we attack that so that the healthcare system isn't always picking up the tab and the providers aren't always getting knocked over the head with poor care, poor outcomes? The United States is number one in the world in a lot of things, but we have second and third world outcomes for certain things. Many of that's true. A lot of the burden comes to treating chronic disease and then the downstream impacts that happen from that. So I don't know. I think it's worth exploring. I think the models are worth exploring.